This is Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. Down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for this talk. Private equity. Let's talk about that. Private equity is a form of private for-profit ownership that often involves asset management firms investing the money of wealthy individuals. Unlike publicly traded companies, private equity firms do not sell shares and are not required to report as much information. Although for-profit ownership is not new in the U.S. healthcare system, the surge of private equity ownership is. Such investment groups have spent an estimated $1 trillion over the last decade buying up hospitals and doctors' offices. And during that time, the industry's interest in purchasing previously nonprofit hospice centers has grown. There was a study done recently, and of course the link to it is in the newsletter, that Health Affairs has. They did the study. They found that from 2015 to 2022, there were 124 acquisitions of U.S. hospices by 47 private equity firms. Now, most firms acquire just one or two hospices. One investment firm, however, bought up 22 hospices in 10 states and another 14 hospices spanning 4 states. This suggested to researchers that consolidation within the hospice industry was gathering considerable steam, with some private equity firms potentially becoming very dominant players. Now, we know and have reported previously that when for-profit ventures, either commercial companies or private equity, buy up nursing homes, especially private equity buying up nursing homes, we found that the death rate increases by about 10% in 1 year due to a lack of care caused by reduced staff. That was with private equity. Another study was done, what happens when private equity firms buy up hospitals, and it turns out that the number of patient injuries and infections goes up by about 20% in a year when that happens. So it doesn't bode well for patients when money is in the way. Now, private equity ownership in the U.S. hospice industry has surged. There's an estimated 16 to 18% of freestanding hospices are now owned by private equity firms or publicly traded companies as of late in 2025. This shift marks a dramatic departure from the sector's origins as a nonprofit, volunteer-driven movement to actually give palliative care to the dying. Now, while private equity firms claim to bring investment and efficiency, research points to a concerning trend where the profit motives lead to reduced investment in direct patient care in favor of higher profits, potentially worsening the quality end-of-life care, especially given to the vulnerable state of hospice patients. This was in a report published by the Private Equity Stakeholder Project. You can go to that link in the newsletter and you can be shocked. Anyway, here's the kind of things they do. They skimp on services, especially when care is at home and the family can pick up some of the slack. They keep wages low and use less qualified staff. They reduce the staff. They discard patients at 6 months who have lived so that they don't have to repay Medicare for any of the funding they received in that 6 months. And it's important because 90% of hospice insurance payments are made through Medicare. Now, when commercial ventures squeeze all the money out of a healthcare facility, hospice or hospital or anything, at the end of the road, they often declare bankruptcy, and they leave patients and providers and communities in just serious trouble. Every time we've examined commercial enterprises in healthcare, we find that patients suffer in exchange for higher profits. The accountability to shareholders and not doctors and patients is egregious, and it creates an ethical challenge from which few are immune. Now, universal health care, like HR 3069, does not fix everything, but it would help because if we had a federal insurance agency for all of us, and all the healthcare facilities had to provide a standardized level of care just in order to be reimbursed, then the level of care would meet the standard. But until we get there, There are two pieces of legislation that I propose we ask our representatives in Congress to pursue. They are no longer in front of the Congress. They were put in place in the 118th Congress a couple of years ago. One was called the Health Over Wealth Act, and it demanded accountability when private equity purchases a medical facility. Services and staff can't be cut to save money willy-nilly. Some of the complicated real estate sale and leaseback scams used to bleed facilities would be illegal, and the facility would have to have an escrow account with enough money in it to keep the facility going for 5 years in the event of the declaration of bankruptcy. It should be expanded, though, to cover all commercial purchases of medical facilities, not just private equity, because companies like HCA, they kind of do the same thing. Anyway, another bill was brought forward in that last Congress to address problems in the hospice industry. It was H.R. 9803. It was called the Hospice Care Act, and it was introduced by Representative Earl Blumenauer. It aimed to strengthen Medicare hospice by improving patient access, reforming payments, curbing fraud, notably by expanding coverage for palliative blood transfusions, which is good, increasing payments for treatments for chemo and dialysis, and allowing home-based respite, creating transitional inpatient care, and adding a 5-year moratorium on new hospice enrollments to improve program integrity. Let's take an action. Let's let our elected representatives know that we want them to reprise or bring back these pieces of legislation and make them better to help improve health care for all of us. So here's the action. I'd like you to take a moment to let your senators and your congressperson know that when private equity and commercial ventures are involved in healthcare, the patient suffers. Let them know to resubmit the Health Over Wealth Act, expanded for commercial purchases as well as private equity, and the Hospice Care Act. There's a link in the YouTube description box, so you can just click on it, put in your address, and it'll get you the phone numbers for them. If you'd like, on your cell phone, you can just send a text message. It's SIGN, S-I-G-N, space, P-E-X-P-Y-T, all capitals, P-E-X-P-Y-T, to 50409, and automatically this email will go to all 3 of your reps. I'm your constituent, and I'm fed up with companies and investors bleeding healthcare facilities dry. They cut hours, reduce staff, stop offering services, and when money is squeezed out of the system, they declare bankruptcy. Commercial ventures have purchased or taken ownership positions worth about $1 trillion in healthcare and hospice facilities in the last decade. In nursing homes, the death rate increases by 10% in the first year. Hospitals have infections post-surgery that never occurred before, and patients are injured tripping and falling. That's because there aren't enough nurses watching out for them. This is never supposed to happen, but it does because we have very little oversight. Additionally, private equity firms are buying up hospices and reducing the palliative care patients need as they prepare to die. All of this to save a buck. Look, universal health care with a public insurance trust could make a difference by demanding levels of care or refuse payment. But until we get there, I want you to reprise the Health Over Wealth Act from the 118th Congress and expand it to all medical facility purchases. It would make sure that services are not reduced, patients receive needed care, and that there's enough money to protect the facility and the community for 5 years in the event of bankruptcy. If you want to look it up, it's Senate Bill 4804 or HR 9407 in the 118th Congress. Look it up. Additionally, I want you to resubmit HR 9803, the Hospice Care Act of the 118th Congress. It aimed to strengthen Medicare hospice by improving patient access, reforming payments, and curbing fraud. notably by expanding coverage for things like palliative blood transfusions, increasing payments for chemo and dialysis, allowing home-based respite, creating transitional inpatient care, and adding a 5-year moratorium on new hospice enrollments to improve the program's integrity. I know you're busy, but you can keep your constituents from suffering needlessly. It's in your hands. Take action, because your constituents will remember that you cared about them. That's what I've got for you today. If you have comments, put them below in the YouTube comment section, or send me an email at healthcareadvocacy1@gmail.com. Thanks so much. Have a good day.